let's see, November, oh, there we go. On November 16th, the Kent County Finance and Human Resources Committee need to review the allocations and approve them before they go in front of the entire Kent County Board of Commissioners on December 2nd, which that falls on a Thursday. Next slide, please. And for today's lineup, for getting into the content and the meat of the presentation, you're going to hear from each of the Ready by 5 team members that you have here, and we'll go over the provider requirements, the performance trackers, the encounters, number served, and cost. We'll go over reporting, and of course data, and then communications, and then what the next couple of weeks are going to look like with next steps. So Kyle, go ahead and take it away.
All right, everyone. Hello, good morning. So I'm just going to go over requirements and what it looks like to be a Ready by 5 service partner. I know a lot of people on this call are veterans of all this, so I'm going to kind of breeze through these things, but I just want to drive a few points home. The Ready by 5 millage funds, they are taxpayer dollars, so just keep in mind, always keep that in mind. And the services are for children ages birth through 5 and expecting mothers who are Kent County residents. These agreements, while they're 2 years, the allocation cycle is done on a yearly basis. So allocations or funds are allocated and approved on a yearly basis. So for 2022, we're going through that right now. To be approved by the Kent County Board of Commissioners. And then for 2023, the same process will happen about a year from now. And just a reminder that funds cannot be used to purchase equipment or property. So we can go to the next slide here. Some more things. These services cannot be advertised as free or at no cost. And these funds should not supplant already existing private, philanthropic, public, so state, local, federal funds already in use by the proposing agency, which are supporting the services. And all of you have agreed to seek out other sources of funding besides Ready by 5 millage funds, which include grants, other sources of funding for donations, cost sharing, if that is applicable to your program. And we have laid this all out in detail in the service provider manual. So we can head to the next slide. And this slide is more about finance and the pacing of spending. So the goal for every year, whatever your award may be, is to spend all the award funds down. To do that, we need to start in January of every year. And how Ready by 5 kind of looks at the financial pacing of programs is taking the yearly award of a program and dividing it by 12, so the 12 months. And we use this 1/12 amount to as a benchmark to look at spending for a program. So we all know that some months may be busier or maybe less busy throughout a year. That's just kind of the natural cycle of things. So if you're consistently underspending every month, you'll be considered underspent. And then on the inverse, if you're billing over the 1/12 consistently, you're at risk for running out of. So those are just two situations that we don't want to be in. And then finally, that funds that are not spent, they can be allocated through reprogramming or redistribution process. And that, again, is in our service provider manual. We can go to the next slide, which brings us to our service provider manual. This is the great guide that details more of the compliance, the requirements, spanning from your programming requirements, financial, reporting, your organizational requirements. So a lot of the language that staff we use, it can be found in there. So if you have any kind of interpretation questions, feel free to reach out to us and we can help you through this guide. And this is available on our website if it's not already on your bedside table, like I'm sure it is. So, and then we're going to update all this in 2022. There'll be some changes for language. we will go on to performance tracking, which I believe is Heather.
Good morning, everyone. So there's been some updates. I think everybody's aware of how agreements will be tracked. So we are moving away from the unit rate being tied to invoicing to more goals that will be tracked with all of the contracts. So there's 3 performance trackers. There's an encounter unit, a number served, and expenses. So we will take you through all of these in the upcoming slides. We'll start with the encounter unit. So if you recall, if you were the person that completed your application or your proposal, you selected one encounter type in that proposal. So if you don't remember, go back and look and see which one you selected. There's 3 types. There's one specifically for outreach and navigation. There's one for group services, and there's one for direct services, which mean like one-on-one type services. So within the contract, there is a section where you will provide an estimate of how many encounters you will provide. This will be a minimum number. So your actual units might be higher, but we at least want to know, what the minimum is. And the number provided will be used to track the contract performance. So the outreach and navigation, this is the first one, and this is specifically for all of our outreach and navigation partners. And there's a couple components to this one, just because this type of programming is multifaceted. So what we'll be asking for is how many you'll be reaching through your outreach strategy. And each proposal has their own outreach strategy. There's one agency that is reaching new moms through the hospital to touch new parents that way. There's some that are, there's another one through the birth certificate registry doing mailings. So there's a touch that way. So these individuals are not the individuals that you're submitting in your monthly data file, but they should be trackable for count purposes, just so you know how many folks that you are touching. You probably will not be able to collect their names and their demographics. So we know that, and that's fine. That's what we're expecting. Then there is a engaged screen number. So from all the individuals that you reach and you touch, how many you expect to engage in your program. So this would be, the social determinant of health screening. That is a requirement for all programs. How many do you project that you will screen? And then the third one is how many will receive navigation services. And this is defined as receiving one successful referral. So we know that many of those families or individuals served will probably receive more than one referral, but for the purposes of defining successful navigation case, we're setting it at 1. So both of those, engaged and screened and navigation service, those will be included in the monthly submission. And in your template, there was a data template that was sent, and you will see how those are coded. So there's a code for social determinant of health screening, and then there's a code for navigation. And those are the only 2 codes that you use. So we can walk through the data pieces one-on-one with you guys, because I know there will probably be some more specific questions to that, but just to give you a little bit of how that connects to the updated data fields. So it's really important as you're setting your numbers to be realistic. So consider what has happened historically in your program, and just make sure that those benchmarks that you're setting are realistic. So we'll be looking at the encounters that you actually do complete as they're defined here. And we'll also be looking at the cost per individual. And with this rate, we'll also be looking at how many connections, including the status of completed or incompleted referrals, which we have been looking at. We will continue to look at that, but that's not going to be tracked as a formal unit of service. So next slide. So group service is the second option. And so this would be used for healthy development, play and learn programs. This would be your unit, unit type. So this is defined as the encounter type that is serving 2 or more individuals, each from different households. So you could have 2, you could have 10, you could have 25. This is that group type service. So the unit is per group of children. So it's not per child, it's per group. And what we need from you is the minimum number of groups that you will be providing. And we need a minimum number of attendees that you will have in order to hold the group. We don't want to hold groups where nobody's attending. And so that minimal number will be helpful in determining when groups should be held. So also with this, consider your model. You know, every program, every model looks a little bit different. What is prescribed by your model, how many groups are required for the appropriate program dosage. So in order for your program to have impact and to meet the program level outcomes and metrics that are specific to each type of program, how many groups do you need to hold? And also, what has happened historically in your program? So, what is realistic is what we're getting at here. What is your capacity? Again, making sure that we're being realistic with those numbers. So we will be looking at the encounter, which is defined above, the cost per encounter, the number of individuals that you will be serving, and the number of individuals per encounter too. So just understanding how many children or expecting parents, are attending the groups, and that should be regularly more than the minimum. So the third encounter is the direct service, and this is getting at the one-on-one type programming. So it's serving a child, children, or an expectant parent from one household. So for this encounter, you will provide how many units and individuals served will receive through their enrollment in the program. So an example of this would be home visiting and those type of programs where there's regular one-on-one, or there could just be 1, 2, but just where there's that one household that is receiving a service. So again, this is similar to the other encounters. Please consider your model. What is prescribed by your model? What is the number that is appropriate dosage? How many home visits should a family be receiving in order to know that that program has been successful? What is the research? What does the model show? What has happened historically in your program? So making sure that you have capacity to do what you are saying you're going to do. And how many encounters does an individual receive on average? So just giving us an average. We know that there are going to be some families that realistically, they're probably going to drop out of the program before they complete all of them. We hope that that's not a lot. And we also know that there's going to be families that have more needs and are probably going to get more, but just kind of that, just give us an average to help us understand what that looks like. So next slide. Is there a translating the slide before? Yep, thanks. So we tried to put some examples in here. And again, we know that there's so many nuances in each program, and please reach out to us if you have questions about your specific proposal. But generally for the home visiting, we did have some home visiting that we're invoicing per child or even per 15 minutes. What you will do is you'll switch to that direct service one-on-one encounter type, most likely. So based on your model, what is the minimum number of visits necessary? And then the minimum number of home visits a child or expected mother would expect to receive in your program. So this may also be applicable to some healthy development who have kind of that regular check-in type program set up. So if you were doing this on a 15-minute before, we're not doing 15-minute anymore. We're moving everybody to that direct one-on-one encounter type if you are meeting one-on-one with a family. If you previously had a play and learn programming per child, you would be switched to group service encounter type. So you would determine the number of groups and the minimum number of children you expect at each group. Again, that minimum number is not the number that you expect to serve. It's just making that call when you would not have a group or charge or count a group. So your minimum number for the group in order to hold a group, and then we would expect that you would be recruiting more individuals than the minimum for each group. So healthy development per child. Oh, hang on. Healthy development per child. We would switch to the direct services one-on-one encounter type. So this would be defined by a screening completed, by a book received, by a car seat distributed. It would just be kind of that counted that way. And your outreach and navigation, we went through this in the previous slide. So you would be providing the number reached, the number screened, and the number engaged in navigation services. So the good news is, many programs are already counting units by a home visit, by a group, by a blood screening, or by a book distributed. So that will very easily translate to this new way that we are counting encounters. But again, if you have questions, please reach out. And yes, for the outreach and navigation, please include all three of those numbers in your contract. I just saw your question, Christine. As well as, the groups, please tell us the number of groups and the minimum number of kids. So everything that you have on the slide, please include that information in the contract. So, kind of wrapping up this piece, and you probably saw this in the RFP. So we're not using this for invoicing, but we are tracking. What we will do is we will track your actual total encounters compared to what you said you were going to do, what your goal was, to get a % of encounters completed. And in your quarterly reports, if that number is over or more concerning, we're more concerned if you're not meeting that number, we'll need an explanation why. So with that, we'll move on to the next performance tracker, and I'll let Christine take it.
Thank you, Heather. Okay, so the second way that we're going to monitor performance, obviously, is the number of individuals that will be served. So many of you, as you know, received the drafts to your service provider agreements, and specifically in Exhibit B, a description of service, you'll find a table that looks similar to what you see on your screen. So many of the drafted agreements were pre-populated based on the proposal, the application that was submitted, or the answers that were provided to the Resident Proposal Review Board during the Q&A period back in September. But obviously, please observe the comments that we've put individually in each of those drafts, and just populate that table accordingly. So for illustrative purposes, we want to highlight a little nuance here. So as an example, what you have in front of you is a service provider has a goal of serving 60 children over 2 years. So in the column where it says year 1, we want to see the total to be served in year 1. But the special thing to note is that in the column where, or the box that you see for year 2, we want to see a cumulative total of year 1 and year 2. So the total number of individuals to be served over the entire 2-year period. So 30 in the example for year 1, and then 60 ultimately in that year 2 box.
Can I just mention, Christine, because this is like super confusing because everybody counts differently. And the reason that we're doing this is the individuals that you serve in year 1, you should not count them in year 2 if they're continuing from year 1. So if your home visiting program, if you had somebody enroll in December of year 1, they're already counted in year 1. So they would carry over in that 30 count. And then you would start with 30 and they would already be counted in there. And then January 2nd, if somebody enrolled, you would count them as your first for year 2. So they would be 31. So I hope that makes sense.
So this is Shanae. All you're really saying is that you want us to count new people. Is that right?
If you can. So there's a few, it's really hard to do these blanket statements because it's hard to do that with the drop-in models. So let's talk about that. Depending on your contract, it's gonna look a little bit different depending on your model. But for home visiting, we can answer that one. We only want new individuals enrolled.
Thank you, Heather. All right. So a little bit of a specific, note we want to highlight here for the different encounters that Heather just walked through. So we get this question a lot. Many of you have asked us this question. So what if there is more than one child in a family that's served? It's going to be based on encounter type. So first off, the outreach and navigation encounter. So specifically for families who are benefiting from a referral, you're going to have that one target child. But let's say now they're a referral specific to a child, then that individual child would be included. And so this is a way where you could include duplicate counts of participants. Now for direct service, that one-to-one, experience for that child, you're going to have that one target child per household. And the little exception that we have, and this applies to mostly a healthy development, there's certain contracts that I'm thinking of, and I know you're out there thinking of it too. But let's say there is 2 siblings, and each of the siblings are receiving behavioral health, let's say counseling services. And each of the siblings have 2 separate appointments with a different clinician. So you would count those child separately. And if we have any questions about that for my healthy development folks, we can talk about that later. But unduplicated counts of participants for this service type. Now
I'm sorry, Christine, can I ask a quick question?
Sure.
I just want to make sure it's still applicable.
Yes.
Like for our program, we might have a child that starts PALS 1 and then come back for PALS 2. Will that be the same as it was before? Like that would be a new count for part 2 of Baby Scholars, or?
Let's talk about, can we talk about that with you individually, Takia? It just gets confusing because many people aren't familiar with the PALS and
Okay.
yeah, but absolutely, let's check in on that.
Okay, thank you.
We will figure it out, Takia, and everybody else who's probably going, Christine, what are you talking about? That's called meetings for later. Okay.
Okay, thank you.
All right, so moving along, so group encounters, right? Many of our early learning, oh, go back, thanks, Megan. So our group encounters, so the early learning, the play and learn groups, okay? So Heather mentioned this earlier, but we wanna look at all the children participating in the group, so you would count all of those children. The parents wouldn't be included though, so please note that, but this may include participants, or duplicate participants. So that allows for the duplicates. And then we have a unique number served here that you see there, that last column. It's the 15-minute units for indirect services, and that doesn't pertain to a lot of the contracts. This is for special contracts, for example, that provide, let's say FEMR, for Kent County Health Department. They have a contract for the FEMR group that's doing that work. And they don't provide that direct service, so they are having a very unique 15-minute units applied to that contract. Okay, thank you, Megan. Can you go to the next slide? So this looks familiar. You saw this slide in the pre-conference if you were in attendance. So essentially, we're going to look at the actual numbers served compared to the projected that was served. So we're going to use that as a way to monitor. And then just note that if there is any deviation from your estimated number, whether it's 10% less or greater, you're going to have an opportunity during the quarterly reports to provide a narrative for that deviation. So all of that, again, will be done, through EC Impact. And next is, I think Kati is going to go through expenses.
Thank you, Christine. So here's how the reimbursement is going to be for a contract beginning January 1st, 2022. Services will be now reimbursed on actual cost up to the total amount awarded for each year. And some services will also be eligible for additional performance-based payments. All budgeted expenses and performance-based rates included in the service provider agreement will be fixed for the term of the agreement. And even though you are invoicing for actual expenses, you will be required to submit monthly units through the data file submittal. And also you need to submit quarterly reports through EC Impact with the numbers served and encounters depending on the service provided. So next slide. You can see here an example of the reimbursement template that you will use to invoice through EC Impact. This template is based on the budget that you provided. And in this example, you see the column highlighted in yellow. That's where you will enter your expenses by line item. The template will keep track of actual expenses year to date and percent spent as well. You will be able to make adjustments, attach any documents, and make any comments as needed. And we are scheduling a TA session in January to go through this process in more detail. Next slide is how do we track expenses? Well, service providers will be required to provide a narrative in the quarterly report to explain why there is a deviation from the 112 monthly amount, especially if you are 10% above or below your 112. You may invoice for amounts higher than your 112, just to be aware that you don't want to spend most of your funds at the beginning of the year. And that's why we use the 112 to identify programs that may be overspending or underspending. Next slide. Performance-based contracts. So summarizing, payments will come from two sources: the fee for services. This is your actual cost that you will invoice monthly, and milestone payments, which are additional to your actual expenses and will be made based on providers that are able to achieve predetermined programmatic milestones that are consistent with quality implementation to its program model. And services that qualify for these milestone payments are healthy development and home visiting. And there will be more details to come on this one. So Christine will go over now the reporting requirements.
Thank you, Kati. I just want to note for the contracts that are eligible for the performance-based contracts. You probably saw that I had a note in your draft template, agreement draft template, about getting the language for those milestone and outcome payments. We'll get those to you by the end of the month. We're still working with social finance on those, so I just wanted to note that for all of you. So we'll get those to you as soon as we can. Okay, many of you are very familiar with this, the reporting requirements. You know that we submit invoices on a monthly basis, that data is also sent on a monthly basis. And a little bit, Heather's going to go over the DSA, the data share agreement, excuse me, and the BAA process with you. And you're all familiar with that famous CSV file that all the data must be submitted through to the Kent County Health Department. And then obviously we have the quarterly reports that will now go in through EC Impact. This next slide, you've seen it before. Again, you saw this during the pre-conference and the RFP. So again, if you don't mind, thank you. But I just want to walk through it really quick. This is just an illustration of what I've just spoke about. And so you see here in that column to the left, actual expenses are what is going to be submitted on a monthly basis. During those monthly data submissions, you're going to have those numbers served, the number of encounters, and then the Ready by 5 indicators. If you recall in your application, always go back to it and refer to it if you want to, but you selected the indicators for your service and your service type and your proposals. That will be submitted on a monthly basis. And then lastly, again, in the quarterly report, you'll see that the number served, number of encounters, again, will be reported. And then if you recall, there were SMART goals that were included in your application that you had come up with. And those will be included in the quarterly reports too for you to complete. And then lastly, the narrative, any variances that Katya and I spoke of earlier and Heather spoke earlier of, that will be also an opportunity through the quarterly report. And the next slide, just a friendly reminder, please add the program staff if there's additional staff you haven't already added to have access. That will be helping you with the invoice submissions and the data submissions, excuse me, through the millage portal. So the next slide, you heard from Kyle about through an email earlier this week. If you haven't already, you'll have an opportunity to see your budget, to revise NEC impact. So for the programs that were recommended for a different allocation than you originally requested, you'll adjust the budget NEC impact to that amount. And if you've had allocations where the amounts have stayed the same, you can make minor edits, but please note that changes must be within the scope of the original proposal. And don't forget, once you finish the budget, don't forget to click that submit button. And you'll have about 2 weeks. I'm giving everybody until the 16th to go over through this. So that gives our team enough time to go over everything and touch bases accordingly with everybody. One thing we do want to highlight when you're looking at your budget, and it had varied a little bit, we noticed through the application process, but we want to stress this with everybody, to please look at the staff position titles and the expenses in the budget. So many of you had listed direct staff under the direct column for expenses and then indirect staff. So just please make sure you look at those, because we're going to use that as a way to finalize the staff list that's in the contract. So again, in Exhibit B, description of service, there's a table where we list all of the staff that are millage funded. And we need to distinguish between who's indirect and direct, the FTE portion. And then also we need a brief description stating how that position, whether it's indirect or direct, supports the service that was provided in the narrative. And the next couple slides are just some reminders. Again, indirect staff costs, you're familiar with this as well, but we just wanted to highlight this. Again, to be clear, the staff who directly serve families need to be listed under the direct staff costs in the budget. And then examples, this is not exhaustive list, obviously, but indirect staff costs, data support time, time that's spent for preparing for the annual assessments, financial staff who are working on invoices. But especially we want to note that any leadership positions that are included in the indirect staff costs in that budget may be specifically included only if their time is directly dedicated to those specific program activities. We really need to distinguish between that and the direct staff that are listed in there as well. And then the last slide, again, it's just wrapping up. I'm not going to go through this, wrapping up what the differences between direct and indirect. But please, for those who have new or expanded programs, if you haven't already gone back to your teams and really looked at it, is ramp up time considered in that budget, especially in year one? And then also consider, costs that obviously that are not covered by Ready by 5. As you all know, equipment is not part of what is allowable cost, that especially if they're, unless we say so in the RFP, but anything that's over $1,000. Just, note that when you're looking at your program supplies, equipment budgets, and all those lines in there. Okay, so now Kyle's going to go over the quarterly reports.
All right, everyone. So I know a lot of you are already familiar with the quarterly reports. For your current contracts, a big change we're moving to for next year is that we're going to be submitting those through EC Impact. So you will not have to send us files via email anymore. So the schedule will stay the same. So those will be due April, July, October, and January. And you'll be reporting on very similar things as you're doing now. But we do want to go through some specific changes. So, and then also, please don't include any identifiable data in these. So we can go to the next slide, which will take us through all the things that you'll be reporting on in that period. Principally, you'll be reporting on numbers served and encounters provided. And also, if those have any sort of variance, you'll have an opportunity to explain why those may be higher or lower. You'll also be reporting on those SMART goals you had in your proposal. You can also provide the timeline and budget narratives. Again, you can provide any explanation if there's a variance in those. You'll also, like you do now, report on the parent satisfaction rates, either satisfied, neutral, or not satisfied in percent. You'll also be reporting on any staff changes that have occurred in that reporting period. And if there has been a staff change, if someone has been brought on, just please give us a brief biography so we know who that individual is. You'll also just list your trainings that that staff have participated in, funded by Ready by 5. And you'll also share how you're using quality improvement initiatives from parent feedback to improve any areas of your service delivery. And finally, you can share a success story that has happened in that reporting period. But just please be sure to make sure that you have permission to share, as Megan will. She likely takes a few every few months and kind of shares what we got going on. So feel free to include those in there as well. And we can go to the next slide that will take us through data. So Heather, take it away.
All right, so data submissions, many of you are familiar with this piece as well, but just a little diagram. We are using the data submissions. We use those in combination with the number of encounters individuals served you report through your quarterly reports and other reporting. And we reconcile those and we use them as documentation of the service was provided. So we also use it to track utilization of services. And there is a third-party evaluation that is actually just starting this week. So the data will be used for that purpose as well. The monthly data, monthly data, please go back. Thank you. Monthly data submission standards, we have those in the file definition document. And many, are you familiar with the Excel spreadsheet that gives all the code parameters for how that data should be submitted, as well as the standard data field definitions. And that is the Word PDF document that gives more context and description around each of the fields. We've had the quick meetings. Those who attended this past month had an opportunity to provide input, and we are considering the input that we've received. So thank you to those of you who have sent that. And our evaluators are actually taking one last look at it. So we should have those to you in the next week or two. So hopefully by mid-November, we should have those final documents that will go into effect on January 1. So it's really important, and we are going to be tracking this a little more closely now that we have things built out. So if children are over the age of 5, so through the child's 5th year, they are eligible for services. If they are over the age of 5, they're not eligible for services. If they're not residing in Kent County, they may not, you can't invoice the Ready by 5 millage. And if data is not fully submitted, majority of the organizations, you guys are awesome, you get stuff to us, so thank you very much. But if there is a situation where data is not being submitted on time or in a complete way, we're going to withhold your payment. Next slide. Thanks. So I think everybody's familiar with this process. So the monthly data submissions, the CSV file that Christine referenced earlier, this is sent to Kent County Health Department on a monthly basis. It's sent in a CSV file via a OneDrive link that is sent by Kent County Health Department to make sure that the information is sent as securely as possible. And these submissions do contain identifiable data. So please do not send them to First Steps Kent. Continue to send them via that OneDrive link. And there's just a little description of how that process works in the diagram. Next slide. And we wanted everybody to remember Appendix C in the service provider manual. So this policy covers standard intake information. Really, that is the demographic file, all of the demographic fields that are required, as well as the service and referral standards. We also have in there that any referrals that you make to other services must have document consent prior. So if you are an agency and you would like to make a referral to perhaps, a family who needs food assistance or, any other resource that is in the community, you need to have their consent before you share their information with that other agency. So that is included in the consent that we have provided. There is also informed consent language, and we cannot modify this at this time. This was added to comply with Kent County Health Department data agreements. And also, I mentioned the evaluation that is just starting this week. All of that was written for those purposes. What I will tell you is that we acknowledge that the consent language is very burdensome and very long and very comprehensive. And as we begin to establish more details with the evaluation, we're hoping that we'll be able to reduce some of that once we understand what we really need and how we're going to move forward with that piece. We will be looking at modifying that language. So just know that we are hearing you, and we know that it's an issue, but we don't want to change it and then change it again. We just want to make sure we know what we need before we make any changes on you. There's also a privacy notice in there. This does not replace additional requirements that you might have on how you use and disclose data for other reasons, for other funding sources, for other projects. So this is Ready by 5 only. So you can weave that in to your current language. You don't have to give people two policies. Next slide. So there's also, and we touched on this a little bit, detail on how the data will be used and shared in this. So it talks about, you know, when a service provider will retain and use data once an individual is no longer participating in service, how data will be stored at Kent County Health Department, data that will be shared with the Kent ISD, and that is directly tied to that evaluation piece that we have been talking about. It also outlines the data that will be shared with First Steps Kent. We get de-identified data that we use for tracking purposes, and just how data will be used. So all of that is disclosed in this privacy notice. So just a reminder, with that consent language, the consent language is between the service partner, so you and the family, and it gives you permission to send the identified data to Kent County Health Department. And again, it gets into the disclosures where the data is being sent and how it's being used. And so it makes sure that you are covered in terms of if you offer referrals. It explains how consent can be canceled, and it is modified for each type of service. And we will be, there may be tweaks in this just to make sure that we're aligning with the new service and program types that we have coming online. So it's really important that you obtain consent before an individual's data is sent to the Kent County Health Department. And we do have ways of, you know, of allowing you to send information about encounters that you have completed without sending that identifiable data. So if you have questions about that, I know we've talked to many of you about that, but we are happy to walk you through how that can be done. Next slide. So I believe everybody's familiar with the data share agreements. We just keep it really simple, and we just attach a new agreement to each service provider agreement that you have in place with us. So the language will be same. It'll just be a new agreement that we will just update with the service provider agreements that are going into place on January 1. So there's two types, just a reminder. If you are a covered entity under HIPAA, there's a BAA template that you will probably want to use. If you are a non-covered entity, there is a data agreement that you may use. So it's up to you to determine which type of agency you are, but you will have templates for both, and please use the one that is applicable to your agency and send it back with your service provider agreement. So you'll see an email coming out in the next, you'll see an email coming out in the next week or so, and we'll include links where you can download those documents. And I just saw a question. Thank you, Shanae. What is BAA? It's a business associate agreement, which is a specific type of agreement that is used to share data if you are a covered entity under HIPAA. So good question. Sorry about the acronyms. So this agreement, because there's an agreement between your agency, between Kent County Health Department, and in the data agreement instance, First Steps Kent, there's a lot of signatures going on here. So what we will ask is that you review that document, sign the document, send it to us. We will have Kent County Health Department execute all of them. We'll just send them in batches, and then we will send them back to you. So just to keep things a little less complicated with all the paperwork getting shuffled back and forth. So, next slide.
Okay, so we're on to communication standards. I was going to put in the chat the millage portal. I'm sure you've all been there before, but on the millage portal, you can find these communication standards. The main thing to keep in mind is that the logo, the dual logo, First Steps in the Kent County, should appear on any brochures, publications, documents, PowerPoints that are made possible, that are for the program made possible by the millage. And then we also have these shapes, which are another logo we'd like you to put on everything, which is more like branding and something parents can look for to know that you're part of the Ready by 5 network. Also on the millage portal, there's a few in the standards, there's like key messages about how you can talk about the millage. Things like make sure you're writing out Ready by 5, capital R, by capital F. So Ready by 5, early childhood millage, and ways to talk about how the program is funded. So you can't say we're offering this free service. You have to say this service is made possible because of Kent County taxpayers and the Ready by 5 early childhood millage. So that can all be found in the communication standards. There's also expectations as a grantee. So things like if we come out with a report and ask you to share it out, you are expected to share this report out with your folks as well. But also just sharing stories back with me and taking pictures and yeah, sometimes like I went past the library yesterday, the Seymour Library, and I saw Comprehensive Therapy Center out there. I had a play and learn. So I was just like, somebody send me those pictures. That's good. I can share that out. And when in doubt, if you have questions, just send it to me. I'm happy to approve any press release or publication or brochure you have. Here's a couple of resources for you. So on the millage portal, in addition to the logos and communication standards, you can find all your dates and deadlines. You can find the login for EC Impact. You can find instructions on interpretation and translation. And then other resource we have for you is Provider Network News. So this again is on the millage portal here, and we try to send this out every Wednesday, just has any updates we have for the week. And I tend to put repeats in there in case people don't get to read it, but just keep an eye out for that. It's mostly Wednesdays. And then just a couple of quick things as we move towards December 2, that's the day we'll be able to announce all these new awards. So I will work on updating the website. So I'm going to be sending profiles to you just to make sure those are still accurate. And then once we announce on December 2, you are welcome to share out the news that the awards have been approved.
All right, so I'm going to take everyone through the next steps here for the next, let's see, about 8 weeks or so. In this slide, the bullets, some of these things are things you'll need to pay attention in those service provider drafts Christine and I have sent out. So the contract language is making sure it's consistent throughout the entire document. We spoke about those number served and number encounters. The number served now likely are just the year 1, year 2, so we'll have to just switch over to those cumulative numbers. So just make sure that we're keeping aware of that. You guys are working on your budgets and updating your staff positions, which we have put in the contract drafts as well. You'll throw in your timeline in that draft as well. The data fields, the partnership agreements, just make sure you're reviewing and editing those as necessary. And if you are a program with cost share responsibility, be aware of those items. And then review and sign the data agreement, which the link is on our website, and we'll also incorporate that into the contract when it's fully executed as well. So we can head to the next slide. So here is just a quick timeline. Christine and I would like everyone's draft to be back to us by November 12th. So that's going to start kind of the first round of edits and negotiations. Like we said before, you'll have till November 16th to submit that final budget that will be put into the contract. And then between the 12th and the 20th, Christine and I will be kind of going back and forth with you to iron out all those details and the language within the contract. And then December 2nd, the Kent County Board of Commissioners meets and they will give the final approval for the funding recommendations. And the next day, we hope to be sending out the final drafts for execution. So going through those formal steps to get it all executed. And then January 1st, the services begin and the contracts begin. And then, like I mentioned earlier, we'll be updating some language in the service provider manual with in regards to cost sharing, some service descriptions, putting in those actual cost languages, and then just clarifying language throughout the whole document. And so the final data standards will be sent out in a couple weeks here. So in mid-November, the invoicing and reporting deadlines are already posted and they actually should be in those service provider agreement drafts. We put two tables in there for you. And then the EC Impact Training Manual will be updated for 2022. That'll include all the new items, so invoicing and then quarterly reports. So all those instructions will be put in there. And all of this will be available on our millage portal. And we can send a link out to that as well if you don't have it already. And we can head to the next slide for some future meetings. So in 2022, we will reconvene January 20th in the morning. Like Kati said, we're going to go over the invoicing procedure and then also the quarterly report. So this is kind of like a technical assistance session that we can really dive into detail how you'll be completing these things through EC Impact. And we will also continue our quality improvement consortium meetings in 2022. So our quick meetings, and those will be sent through EC Impact. So just make sure that you're RSVPing through EC Impact. And we put the schedule down there below for all the program areas. So just to note. And also we'll be doing our Navigator roundtables in 2022. And those are always the last Wednesday of the month from 1 to 2:30, but there'll be no meetings in July, August, and December, as we kind of know things are busy in there and we want to give you guys a break. So I think we can go to our next slide, which is an opportunity to ask questions. I'm sure we'll have some. So I think we will probably start I'm not sure if we have any unanswered questions in the chat, but if you want to pop on and throw us a question, we can help you guys out.
There was a question from Jessica. Great question. For those providers with continuing contracts, how do we handle next year where one contract will be paid per unit with overlapping funding being paid for actual?
Yeah, I think we are talking with the county to see if contracts that are using unit rate, but they have a continuation of the program in 2022 to see if they can also be changed to actual cost. And so that's where we are now, right, Heather?
And then let's see, Rachel asked, we are recording this meeting and we'll probably post that on our website and on the millage portal as well. So, and the slides too. So it'll all be available. So Tim, the quarterly report due for January 15th, but the TA is scheduled for, I believe that would be for contracts ending this year. So you'll have a month to report on those. So we're not expecting you to have a quarterly report for, 2 weeks of new contracts. So that's for the old contracts, if I'm correct. So.
Yeah, that's correct, Kyle. So we're gonna have everyone that's current contracts with reports due in the format that we traditionally have them in. And if we have any additions to that narrative that we might need, as you know, a lot of your contracts are, as I'm looking across the board here, a lot of them are terming out. So we might have some additions to those contracts narratives, but we'll let you all know.
If we need to ask for an adjustment on some of the due dates that are coming up in the next week or so due to staff vacations, is that something we can ask for offline?
Yeah, just let us know, Barbara and Shanae, and just let us know what's going on. We understand, I know with the holidays coming, but as you all know, we also didn't want to have you all executing contracts on Christmas.
Right, right. Just the,
yeah.
right, just the upcoming due dates for next week are some of the ones that we're gonna have to maybe push a little bit. So I'll send you an email.
Sounds good. Thank you.
Thanks.
And then Tim, I don't think I answered your second part of your question. So January 15th deadline for the current contracts, you'll just be emailing them like the same. So it won't be done in EC Impact, I do not believe.
Contracts are due now on the 16th, or our budget separate. Yes, so Shanae, we want to get everyone to review those budgets by the 16th, because that's going to inform how we complete the agreements. So if we can get those, if we can lock those in by the 16th, that would help us a lot with the timeline to try to get these done before the holiday season in December. That'll give us, our goal is, to have that following week to really look at all of the drafts together with the budgets and then turn it around, with another round of review for all of us. Because as you know, Kyle and I are splitting those up and there's a lot of you all. So we got a lot to review. Christie's asking, what flexibility will we have within budget line items when submitting our invoices, spending the funds?
So, and Kati, you can tag team with me on this one. So we're going to ask that you submit, but you'll need to explain to us why there's a variance. So we do know that, staff changes, things happen, but you just need to be able to explain and, kind of justify why there are variances. Did I cover it, Kati?
Yes.
Mr. Peggy,
Yeah, hi. Yeah, I had a question on, as you had mentioned, one individual per household would be counted. And I was wondering about cases where, for example, you have twins, we'd be reporting on, individually, one might be low birth weight, one breastfed, the other not, or cases where we have, say, a newborn and a 15-month-old that are receiving different services, different interventions.
So this is where it gets tricky because everybody's model, some models are targeted at the child, some are targeted at the parent. So can we talk through that with you, just to make sure that we're representing your model? We want to try to, yeah, we want to make sure that everybody's counted, but we also just don't want to count children to count children. So let's talk through that. And what we can do too, we can wrap up questions here, and there's still a little bit of extra time. So if people want to stay on with individual program questions, you're welcome to, but we'll put like parameters around it where it's the information in that second session is not applicable to everybody because we have quite a salad going on here.
Okay.
Shanae, it's the 10%. So as you know, we always do that 10% last grader. Sorry, that question was for what's the variance threshold for reporting? Sorry, all if you didn't see that in the chat. Thanks, Candace. All right. I guess if folks want to stay on and go over individual questions, we can start doing that now. And we totally understand it's Friday morning and everybody has other things to wrap up before the end of the week. So thanks, Shanae. Hi, Tanya.